Welcome to the ProAdjusterSRT Quick Tip Series. I'm Dr. Matt Goldman with the ProAdjuster Group, and today I'm going to show you our hip protocol utilizing the ProAdjusterSRT. You can see we have our patented extremity blade tip. You can notice how it's curved to maximize the amount of contact surface area with that particular joint. In this example, I'm going to have the patient abduct and adduct the legs while I'm delivering the treatment. Go ahead. So I'm going to contact the posterior glenohumeral joint. I'm going to put this right over top of the back. All I have to do is apply the 6-pound preload, pull the trigger, and let the instrument do all the rest of the work. Very comfortable, very effective, very efficient form of delivering treatment to a hip that is either restricted or showing signs of discomfort. 3 different points of contact for this protocol: posterior, superior, and then I'll do anterior to finish up this protocol. Notice the patient is continually moving during this to help improve the motion within that joint. And that is how you would perform a hip protocol using the ProAdjusterSRT.